It is 9:18 on this 31st day of January. Kelly Bogowith is with me here from OSF Healthcare. And what a, better time to talk about concussions and so many of these things with Super Bowl Sunday approaching, college basketball's going on, wrestling's still going on. There's so many things. And Kelly, thank you for joining us today.
Oh, anytime. I'm so glad to be here.
I'd have a better time if I got the right microphone going for you, but that's okay.
That's okay. We'll make it work.
It's been a rough morning. I've had Dexter's Laboratory and anime series pop in on the Google Meet line, and I can't get a microphone right, but that's okay. So I got to ask you, right off the bat, as we're talking concussions and some knee arthritis here, let's start off with just the generic right off the bat with concussions. What is actually a concussion? Because, we hear so many times, do you have one? What is the actual definition of one, if you could?
Yeah, so a concussion is actually a type of traumatic brain injury, typically a mild one, and it's caused by a bump, blow, or direct impact to the head. Mm-hmm. It also can be sustained by a quick movement to the body where the head may be thrusted and essentially the brain ends up getting sloshed around inside of the skull, and that creates chemical changes in the brain, and that can stretch and damage the brain cells.
I got a question. So, even let's say a roller coaster that's jarring, could that cause a concussion? Like what I'm talking about? If you're on a roller coaster and get kind of swung around, could that even be a cause sometimes?
I guess potentially. I've not had anyone
on the spot questioning.
Yeah.
I love this.
Yeah, but I guess so. It can you get enough jerk to your body, and it moves your brain. So I guess there's potential for that, though. Really.
Well, and another thing too, I think so many times we've heard the adage, just shake it off, or especially when you've been playing soccer as long as I have, you hear the kid that maybe takes a header to the, right to the face, and the dad's on the sideline, get up, keep playing, keep playing. Why is it, really important not to do that and really evaluate this? Because it could get pretty dangerous pretty quickly, correct?
Yeah, concussions can be very dangerous, especially if one returns to sport or other more vigorous activities when they're not healed. So, it's really important to report these concussions to, if you're a child, an athlete, to the coach or to your parents, or as an adult, obviously you need to talk to your healthcare professional, because there can be pretty long-term circumstances at times for people that have a concussion, and then especially if they have a second, and even that can be lethal, believe it or not, anyway. So
really?
We want to make sure that people are taking it seriously. And I think sometimes athletes especially want to push through it. Mm-hmm. They don't want to appear weak or lose out on their playing spot in sports and that sort of thing. So I think it's becoming more common to report concussions. It seems like there was a time that we would sort of just continue to have that athlete play, and we know that's definitely not the way to handle it. The athlete needs to come out of sport for the rest of the day at least and be evaluated by a medical professional.
Absolutely. Well, what do some of these symptoms look like? Are there a couple of different symptoms for a concussion? Is there really one blueprint of, this is, the warning signs, or this is it?
Yeah, well, there's actually a lot of different concussion symptoms, and that's why it's so interesting, because everybody presents differently, it seems like. And that's why they're so fascinating. When I see someone who's come for concussion in physical therapy, it may have been from a fall or a sporting event or a car accident. That's another common cause that I see. But there's just a wide variety of symptoms. And it can be a headache. It can be dazed or stunned. Someone might be forgetful, confused. They might answer questions slowly. They might even have mood, personality disorders, trouble sleeping, like trouble sleeping too much or not enough.
Now, is there, not to cut you off real quick, but is there something with the pupils too and dilation? Is that a way you can tell, or is that something that I'm just remembering wrong?
Yeah. And that's actually a red flag for the person needs to go to 911
really?
Or call 911 or go to the emergency room.
So there's different levels for you to look at.
Oh, yeah. So those things that I mentioned just a second ago are more common concussion symptoms, but there's some things that are more serious than others. So one pupil being larger than the other, need to go to the hospital. Seizures, need to go to the hospital. worsening headache, need to go to the hospital, slurred speech, weakness, numbness, decreased coordination, and then like loss of consciousness.
Right.
If you lose
I can't even speak half the time doing this show. It's all good.
if you lose consciousness, you might have a concussion, and you definitely need to go to the
Is
hospital.
this the time to tell you I've never had a conscience, Kelly? Oh, sorry, bad joke. Okay. So it's really good to know that. I mean, because honestly, I didn't know that there was different, levels of severity when you look for things. So if I'm a parent at home and let's say I got a, 10-year-old, playing soccer or maybe, playing baseball and felt pretty good. And, they're complaining about a head. When's the proper time? How many symptoms do you get? So if they have a headache or maybe there's some other, how many do you kind of go, all right, if there's 2 or 3 of these or maybe 4, take them in. What do you have kind of a rubric for that?
Well, I think if there was a known incident,
okay,
like a head injury, and the child or adult is acting differently, they need to be evaluated by a medical professional. Okay. So that in sports, the child needs to be removed from play and evaluated by a healthcare provider. And then he or she needs permission from a doctor in returning to sports and school even too.
Right.
And for adults, and say it's a fall or motor vehicle accident, they need to get with their doctor about when they're ready to return to work, because sometimes we'll have people returning to sports, work, or to school on, say, a graduated schedule, depending on the severity of the concussion, because symptoms will develop typically within 24 to 48 hours.
Right.
So it can be evolving. Someone can present one way 24 hours later, and then those symptoms could change better or worse. And the thing too about concussions is they can last a week or they can last even months or longer.
And see, that's what confuses me is I don't understand. I think that's the thing I'm still learning, because I've actually been fortunate enough to never have one, thank goodness. But so concussions don't just, go away within 12 hours or go away within a certain amount of time. You can have this for a while.
Yeah,
really?
Exactly. And there's a lot of research going into what happens when people have cumulative concussions. So we can't really speak to that, I think, too much, although we know that's probably not a good thing.
Right.
But there's a lot of research being done on that. And then there's, the Will Smith movie Concussion that talks about chronic traumatic encephalopathy. And that's something that can only be tested for after the person has died. And that's more like where the NFL players come in, and they're acting just completely different person with depression and sometimes even like suicidal and that sort of thing. But those are, pretty severe impact after impact, thousands of times in those people's career. So obviously most people that suffer concussions don't have long-term consequences, but we do need to take them seriously.
And to me, I think it's really, a good point to make too is, you don't just have to play a sport to worry about this. I mean, especially with the ice that just came in. I mean, all it takes is one, kind of nasty tumble and you're in that same boat as the, a player that just, got his head rocked a little bit or, fell pretty hard. Is there something to do immediately? Let's say we're a little bit older. I'm out putting some salt on the driveway, and I think I can do it, and boom, legs come up, and I'm a little bit on the ground. What's the thing to do immediately after, experiencing any type of head trauma? Is it just evaluation first and foremost?
Yeah, well, I think it's best to tell someone first of all. Right?
That's true. She's the healthcare professional. I'm just, here for the duration.
Well,
no, you're right.
Because sometimes you don't have a good gauge on how you're doing. You might think you're fine, and if you tell your husband, your wife, your boyfriend, mom or dad, they might be able to pick up on those subtle changes. You think you're good to go.
Right.
But sometimes, other people will be able to say, gosh, like, she doesn't seem like she's acting right. She's, stumbling a bit, or she's having trouble just answering basic questions, or is a little bit forgetful, something like that,
That is really interesting because, to me, I always think that there's just, one size fits all method to a lot of this, but there's really not,
Right.
Well, I got to ask you, so when you talked a little bit ago about long-term, side effects to concussions and, the duration could last in who knows? It just depends. What are some of those, recoveries like for someone that has, these issues that keep stacking up and piling up? What's that long-term recovery look like for somebody suffering through this?
Well, I think that's why concussions are so fascinating, because the trajectory is so different. You know, you might have someone who's had a second concussion after a first one years ago, and they're fine within a week, you know, and then you might have others that have it for months, and then we call that post-concussion syndrome, when those symptoms just linger. And then those people typically will need to have a neurologist on board, and then other like specialized services. So that's pretty rare, but again, that does occur.
Well, and that's something I wanted to ask you about too, because I remember just, you know, maybe about 10 years ago, you know, Jason LaRue was a catcher for the Cardinals and had to quit playing because of the concussion syndrome that he was going through. You know, I guess, what does that kind of look like? Because that's still something I can't, you know, actually wrap my head around, honestly, is what that kind of day in to day out looks like with somebody that's going through that type of syndrome or you know, that stress of, you know, the post-concussion trauma.
Yeah, and some of those symptoms that happen acutely can also continue for the duration of weeks or months and that sort of thing. So that can be like memory loss, you know, decreased concentration, having trouble recalling events before or after the concussion, headaches, that kind of thing. So it is interesting because those things can last for months and months, and that's really troublesome, you know, trying to work full time and that you can't remember things that you need to. So that's why we always encourage telling somebody, talking with your medical provider, and then at OSF Rehabilitation, we offer the physical therapy, occupational therapy, and speech language pathology. And we evaluate and use that multidisciplinary approach to educate, goal set, and put together a comprehensive treatment plan, because everybody's different, you know, and we want to make sure that we're catching those subtle differences from where the person is now, from where they normally are, as much as we can, so that the people can return to their recreational activities and school and work and all that good stuff.
Well, absolutely. And I mean, obviously, the thing that sticks to my mind is, in your experience with the physical therapy side of things, do people get a little abrasive after some time doing the, you know, recovering from a concussion after doing the treatment plans with you guys? Do they get kind of apprehensive, going, okay, I've done enough, I can go? Why is it important to really stick to this and drive it home that you're recovering the best way?
Well, we want to see the people through to make sure that they're safe to return and also to get the help they need. Yeah, I mean, definitely people get tired of coming to physical therapy
my mom
for like anything, right? Let's just be realistic.
My mom works at Del Mar Gardens, and she was like, "You're damn right they do. I'm tired of working."
They do. Yeah, but we want to finish out the treatment program, and it is a lot, you know, and not everyone has all of those symptoms that I mentioned just a minute ago, but it can be a lot, you know, and with that, a lot of times people have anxiety and depression, not only because of the concussion, but because of all the other stuff that it affects. You know, if you're not able to work full time, then that affects finances and potentially relationships with other people. So, yeah, I mean, I think that definitely builds on like anxiety and depression and that sort of thing. And sometimes people that have those problems baseline will have them even worse, to be honest, sometimes after a concussion. And a lot of times we do call in referrals for psychological services. So we offer that at OSF as well, since there is a big impact, you know. And even, you know, I didn't mention like neck pain, but really a lot of times people have whiplash, you know, when your head or your body gets whipped around, then you have like this chronic pain. And of course, when you're in pain, you're not feeling well. And then that affects your relationships too. So it's a lot. It's just really a lot.
So another thing that I think is really important to point out, especially, you know, just in like, you know, I keep circling back to this, but just so many people I know that have, you know, gone through the gauntlet of, you know, pro wrestling on television, and you get these concussions and you get this head trauma, and they rely on, it seems like, you know, pills a lot of the times, or some type of, you know, cure all that, you know, I can at least get through the next day. Why is it in your mind just so much more important or so much better to stick with like a therapy treatment like this than to kind of rely on any type of medication to help kind of power you through the bad couple of days or weeks you have? Sure.
Yeah. Well, you know, I'm going to kind of say it's important to follow what your doctor tells you to do, that sort of thing. Obviously, I don't want to I don't want to step on anybody's toes with that. You know, but in my opinion, you know, if you're having to take a medication due to headache or neck pain or something like that, I kind of wonder if you are ready to go back to work. We want to fix or anyway, maybe not fix or even treat the impairments, rather than say mask them. So it's important, I think, to get a multidisciplinary approach. That's where the rehab comes in, and then the medical side, and then sometimes psychological services. It all kind of fits together, right?
Yeah. And that makes so much sense. And Kelly, I'm having a blast talking with you because concussions are a really fascinating thing and I think you hit the point so perfectly that there's no one size fits all for concussion. There's a bunch of different symptoms, things to look for. And another thing that I want to talk about, if it's okay for you, we do have to pay a bill here in just a few seconds, but knee arthritis, because right now it seems like I just got off the phone with my grandma like an hour ago, and I can tell it's going to rain again today, or I can tell the snow's coming. So I want to talk to you a little bit about knee arthritis before I let you go, but we got to take a quick break real quick. We'll come back in a couple minutes with Kelly Bogowith OSF Healthcare, and to learn more about knee arthritis.
RiverBender Radio has built 3 great new stations just for you in the Riverbend. The Eagle, the Riverbend's classic rock station. The Bridge, hit music for the Riverbend. And The River, today's country, and all your favorites. Check them out today at RiverBender.com.
I just got a new air conditioner. Top of the line.
I bet mine's better. It's so efficient and quiet, I hardly know it's running.
I've got you both trumped. I've got a Linux.
So do I.
Barrett Heating and Cooling carries Linux products to meet any budget. Don't gamble with your energy dollars. Call Barrett Heating and Cooling and start saving today.
Lennox. Innovation never felt so good.
Macias Insurance Agency, providing quality products with extremely competitive prices. As an independent provider, we source multiple companies to offer the best rates possible. Covering auto, home, business, and life insurance, our goal is to provide quality service that meets and exceeds customer expectations. You can rest easy knowing the Macias team is working round the clock to ensure that both you and the most important parts of your life are covered. Our qualified professionals make the insurance process easy so you can live carefree and focus on what matters most. Visit MaciasInsuranceAgency.com today to find out what our team can do for you.
Are you in the market for new flooring? Look no further than Ed Eagles Discount Carpet. Ed Eagles has an enormous inventory of carpet, tile, vinyl, and hardwood with professionally trained carpet installers that will treat your project and home with the utmost respect. Lowe's and Home Depot can't even compare. Our discounted prices regularly beat out the big box stores. Stop by today to have your new flooring ready for the holiday season. Ed Eagles, quality carpet, tile, vinyl, and hardwood at discount prices, located on Humbert Road in Alton.
Inspiring her dreams and helping her pursue them. That's why we protect your house and your car, because we know they're the launching pad to their dreams. And now you can save up to 23% when you bundle your home and auto. American Family Insurance.
It's the head dead yet. And all the boys in the newsroom gotta run and bet. Get the widow on the set.
It is 9:37 and we are right back here with OSF Healthcare's Kelly Bogowith. We just talked about concussions, had a great conversation. I learned so much because this is something I need to learn about with doing the things I'm doing. And because, everyone always goes, Kelly, they go, it's just, it's fake wrestling. But the steel chair really isn't fake. That's when you just throw your hands up and hope for the best,
Wow.
And it's something, though, I really was fascinated with. And another thing, honestly, I'm getting to the point now, and I hate to say this because a lot of younger people are starting to tune in. My knees hurt all the damn time. I don't know what it is. And my grandma and I have this game, and I know it's coming every time she calls. We talk all the time, and she'll call me and go, knees hurting. It's going to rain today, or it's going to snow.
She's a weather person now, isn't she? Yeah. But it's damp. It's cold. Yeah.
And then she's like, well, my knees are hurting a weird way. Well, then all of a sudden my knees started hurting, and I swear it snowed. It started snowing.
So you could just do the weather right now, right?
I'm telling you, we're ready to go. But, it's really something to take, especially with the colder months. It seems like that's when, she has more of the issues with her arthritis flaring up a little bit. And wanted to ask, I don't know anything about this. I'm not a healthcare professional. You are. Can I have you define arthritis for me real quick, just to let me know what this is?
Yeah. So it's a musculoskeletal disorder. So that just means a bone and joint problem, basically. And it's associated with varying degrees of disability impairment, right? Everything from a little bit of ache to pretty severe problems. And knee arthritis is characterized by a loss of cartilage and remodeling of bone. And then you also have the inflammation component too.
Okay. Now, with this, why does it seem like, is it just because we walk so much, or maybe we're always, moving? Is that why our knees, it seem like it affect, you hear people talk about their knees more than the wrists a lot of the time? Because I hear the wrist, but I also hear the knee more than I hear anything else.
Yeah. It's because it's such a weight-bearing joint.
Okay.
So there's a lot of pressure on the knees with very little weight-bearing surface. So basically there's just a lot of compounding stress as we walk and go about our daily activities. But it can be, yes, you're right, all over. Elbows, knees, wrists, hips, ankles, everything really.
So I just wrote down compounding stress. So whenever we sell this band, that's a great band name. We're going to make some money off of that one. We'll sell that one off. But you're right, because I've always wondered that. And it seems like, and I hate to, I'm not picking on anybody, but it seems like especially a little bit, maybe taller we are, bigger our body is that where you start seeing a lot of that pressure, seeing a lot of more, arthritis cases or more issues with the joints and mobility? Yeah.
I mean, obesity is the biggest predictor in progression of knee arthritis. Yeah. Yep.
Wow.
So and one of the risk factors for getting arthritis is actually a job that requires you to do a lot of like squatting and kneeling and that sort of thing. Just a lot of use on your knees.
Wow. Well, and so what are some of the symptoms or things to look for? Are we going to see inflammation right away? Is it going to be, red? Is there just going to be pain? And let's just start with that.
Yeah. Not so much like the red color, but typically it's going to occur in people older than 50. But of course, people younger than 50 can certainly get arthritis. But it's just a predicting factor. The older you are, I mean, you're more likely to get arthritis.
She just stared into my soul.
Oh, no. So we've got greater than 50 years old,
right? Morning
stiffness, less than 30 minutes, and a sensation of grinding. You move the knee and you feel that that sort of, you want to spray some WD-40 in there, that kind of thing. Yeah. Right? I wish it were that easy, but it's not.
That makes sense. Well, is there any more kind of things that are just generic?
Yeah, bony tenderness. So the knee feels, it feels tender when you push on it. Bony enlargement. So you might feel, the knee is a little bit bigger. And not necessarily warmth, though.
Okay.
So I would say that those are like, and then, with that, like functionally, you might see muscle weakness and difficulty rising from a chair, using stairs, that kind of thing.
Now, I got to ask you, because I don't know what this is, and I might as well just throw you on the spot because we're here now. I have this thing where it feels like there's rubber in my knee, almost like a rubber band. Is the same thing, or is that a whole different ball game that I need to deal with my own problem?
Well, you have to come in for a physical therapy evaluation.
There you go. Good answer. Good answer.
Yeah, there's a lot that really, to determine that, it has to be diagnosed by a physician. So I can't tell you on the spot, like, yes, it's this or that. But say when someone comes to physical therapy for an evaluation, that's what I'm trying to figure out. Do I think it's this or that? What are the person's impairments? And what can we do to help? Do we need to work on strength? Do we need to work on flexibility?
Yeah.
Sometimes we have to work on balance. Those things all play together. So it's hard to say in your circumstance.
And I didn't mean to throw you on the spot because I know I shouldn't do that, but I just,
it's okay. I'm used to it.
I can't help it, But what limitations does this cause? Is it a range of motion issue at times? Is it, just a weight bearing thing? What are really the biggest issues when it comes to this?
I mean, all of those things. Yeah. Quadriceps, so that's the front of the thigh muscle. Sometimes we've got weakness there. And that's one of the biggest things we can do is improve the strength of the quad.
Really?
So, that actually helps with pain and function with people that have arthritis.
I only say that because I just look at the quad compared to, other parts of the leg thinking, well, it's already, bigger, in size than all the other leg. But I guess people don't.
I think. Yeah, well, and that's where we check that out when you come in to see us, or is it, because I think a lot of people think, gosh, no, my strength is good.
Right.
I lift weights or I do this and that, but a lot of times we can kind of get in there and figure out like, hey, this, you're doing really well in this area, but this is what you need to work on,
That makes so much sense, Kelly, because so many times, I had a dose of reality the other day. I was, having to get up there with the screwdriver and my arm almost fell off after 5 minutes, and I'm going, CJ, don't look in the mirror today because you won't make it. You're going to start crying. It's not worth this. But, in terms of age, it's mostly in older people that you're seeing, but younger people are very easily able to have this as well, correct?
Yeah, definitely. Yeah, even people 20s and up, and same for arthritis in your back, that kind of thing. Yeah, and it depends on the person. There are a lot of factors that go into arthritis, and that can be lifestyle, so what types of activities you do, genetics plays a part, like family history, that kind of thing. And then even prior trauma to the knee, so for example, people that have had meniscus problems are typically more likely to have arthritis later on, unfortunately.
Oh, well, that's great for me. Okay. Well, I just want, this is really an interesting topic, but for you, is there, kind of a baseline that you use to try to start, treating arthritis? I'm sure catching it early or kind of starting to kind of treat it early is better than waiting a couple of years and going to see your physical therapist, but is there a baseline for that?
Yeah, I do recommend if you're having impairments that are affecting your day-to-day activities, like your ability to use stairs or rise from a chair, or you're noticing the decreased motion, it is good to get and talk with your doctor about it. And then we'd be happy to evaluate you in physical therapy. So we, again, address the impairments that we find with regards to strength, balance, flexibility, all of that. And then typically we see people at OSF Rehab physical therapy, say 4 or 6 weeks, something like that. And then we try to get you on a home program. So then you can manage it on your own. We want you to make sure that you're able to help yourself. We don't expect you to come to physical therapy the rest of your life, right? So we get you on a home program and then you continue it.
I just want to look in the camera right now and say, I told you, you weren't going to get any home remedies for you guys to try before you call your healthcare provider. That's step one always, Everyone just they WebMD it, and then all of a sudden the next thing you know, you got some terrible disease and you're in the emergency room.
Right.
I freaked myself out on WebMD a couple of times.
Yeah, we all do. But we don't want to do a cookie cutter approach.
No,
that's the thing. We want you to come in, and what's good for one person is not always what's good for the next person, and we try to really make it tailored therapy to what you need as an individual.
Well, and I'm not patronizing you, but that's why I really love what you guys do at OSF, because you really do have, different methods and different avenues that you look to evaluate before you just go, throw them into the chair for about 20 minutes. We'll see you next Wednesday. I mean, there's really, you guys tailor make everything for the patient. And I think that's what's really important.
Yeah. I mean, we see all of our patients one-on-one. So that's it's with a licensed physical therapist or assistant too.
Wow.
So I think that kind of sets us apart. But yeah, we see tons of knee arthritis. I mean, it's just probably one of the more common problems people come to therapy in general for, back pain probably even more, but.
Well, let me tell you,
that's like a whole nother show, right?
Oh my goodness. I got about a week back. But anyway, I got to ask you, in terms of staying active, because especially for older people, it seems like once that arthritis starts to set in, the mobility goes down, and then the problems get a little bit worse. How important is it to keep moving? It doesn't mean to break down your knees at all, but maybe just stay a little bit active. How important?
Yeah. Oh, it's very important. Yeah. Mm-hmm. Aerobic exercise is really good for knee arthritis. And we have this little saying. We say, motion is lotion. You know, and you got to lubricate the knee, right?
I needed this today.
Yeah, you got to move it, right? That's how you lubricate your knee, is you have to move it.
It makes sense.
Really? Yeah, light aerobic exercise. So that can be walking, riding a stationary bike, getting in a pool, I know locally here in Alton, there are some good pool exercise classes, or even, literally walking in the pool. You know, the good thing about that is you don't have the compression through your joints. So a lot of people do really well with that too.
Absolutely. So in your opinion, we have about 2 minutes left. When's the best time to, kind of talk to your primary care or talk to your doctor about, when it's time to look into treating the arthritis? Is it right away? Maybe give it a couple of months. What's your suggestion?
I don't know that there's a specific time frame, and I think it's going to be different for everyone. But I think if the knee is impairing your ability to do things that you want to do, it's time to talk to somebody about it.
Yeah.
If you got like a 1 out of 10 on the pain scale once a day, I'm not, if it were me, I probably wouldn't dive too deep into that. But if it's, affecting your quality of life, definitely you need to talk to somebody about it. We don't want to just wait and just push it off.
Absolutely. And when you do, you got to go stop by and see Kelly Bogowith at OSF Healthcare. I'm telling you, I've really enjoyed your time. I took you way too long today, but it's just too much to talk about and such important stuff. And Kelly, anything else before I let you go?
Well, I am glad to be here to talk about the concussions, the knee arthritis, and there's just so many different things that we could talk about. We'd be happy here at OSF Rehab to see you for physical therapy, occupational therapy, and speech language pathology. So thanks for having me and representing our services.
Well, all I know is that I still got a rain check because we got back arthritis and a lot more to talk about coming down the line. Kelly, you're welcome back anytime. You were fantastic. At 9:50 on this 31st day of January, we're going to take a quick break. We come back, wrap up the 9 o'clock hour, and then Unified Child Advocacy Network joins us at 10:10. So sit back, relax, and enjoy the rest of our daily show.